Welcome to the lab. If you are over 60 and you have those twisted rope-like veins on your legs, maybe blue, maybe purple, maybe aching by the end of the day, this video was made for you. Varicose veins affect nearly 1 in 3 adults over the age of 60, according to data published by the American Venous Forum. Most people live with them for years, assuming they are just a cosmetic problem. They are not. Today we are going to be very honest with you about what ignoring them actually does to your body, and more importantly, what you can do starting today to stop the damage. Before we go any further, I want to ask you something personal. When you press on those swollen veins at night, do you feel a dull ache, a heaviness, or maybe a burning sensation, especially after you have been standing or sitting for a long time? Tell me in the comments below. Write aching, burning, or no pain, because your answer actually matters for what treatment path makes the most sense for your body. Thousands of people watch this channel, and reading your experience helps us make better videos for everyone here. Now stay with us until the very end of this video, because the final tip we share, tip number 7, is one that most doctors never tell their patients, and it addresses something that happens specifically while you sleep. It can make a measurable difference in how your legs feel every single morning. You do not want to miss it. Let us talk about the science, simply and clearly. Your veins have tiny one-way valves inside them. Their job is to push blood upward, back toward your heart. As we age, those valves weaken. When a valve fails, blood pools downward. It collects in the vein, stretching it outward. That bulge you see on your skin is a vein that has been under pressure for a long time. A study published in the Journal of Vascular Surgery confirmed that venous valve dysfunction progresses measurably with age, and that chronic venous insufficiency, the medical name for this condition, affects up to 40% of women and 17% of men by age 70. Now here is what most people do not understand. When blood pools in those veins and sits there, it is not just uncomfortable, it is actively inflammatory. The pooled blood releases inflammatory proteins into surrounding tissue. Over months and years, this causes the skin around the ankles and lower legs to become discolored, thickened, and fragile. This is called lipodermatosclerosis, and it is a warning sign that the condition is progressing. Left untreated, a small scratch or bump on that fragile skin can become a venous leg ulcer, a wound that can take months to heal and carries a real risk of infection. According to the National Institute for Health and Care Excellence, venous leg ulcers account for up to 70% of all chronic leg ulcers in older adults. This is not a cosmetic problem. This is a circulation problem with real progressive consequences. Tip number 1, wear graduated compression stockings every single day. This is the most evidence-based, non-invasive tool available for managing venous insufficiency. A Cochrane review found that graduated compression stockings significantly reduce the symptoms of chronic venous insufficiency, including swelling, aching, and the risk of progression. The key word is graduated. This means the pressure is tightest at the ankle and gradually decreases up the leg. This gradient pushes blood upward against gravity. A pressure level of 20 to 30 mm/Hg is appropriate for most people with varicose veins. Put them on first thing in the morning before you stand up while your legs are still at their least swollen. If you have arterial disease or diabetes affecting your feet, speak with your doctor before wearing compression. It is not appropriate for everyone. Tip number 2, elevate your legs above your heart level for 20 minutes, 3 times a day. This uses gravity in your favor. When your legs are raised, venous blood drains passively back toward the heart. The Mayo Clinic recommends elevating the legs at an angle where your feet are clearly above your hip level. not just resting on a low ottoman, but genuinely raised. You can do this lying on your bed with two firm pillows under your calves and ankles. This simple habit has been shown in clinical practice to reduce edema, leg swelling, measurably within 2 weeks of consistent use. Tip number 3, do the calf pump exercise. The calf muscle is sometimes called the body's second heart because when it contracts, it squeezes the deep veins of the leg and actively pushes blood upward. Here is how to do it safely. Sit in a firm chair with your feet flat on the floor. Keep your spine gently upright. Do not slouch. Now slowly raise both heels off the floor, pressing through the balls of your feet. Hold for 2 seconds, then lower them slowly. That is 1 repetition. Do 15 repetitions, rest for 30 seconds, then do another set of 15. Breathe in as you lift. Breathe out as you lower. Never hold your breath. Steady, rhythmic breathing keeps your blood pressure stable throughout. If you have severe pain or swelling in one leg more than the other, do this modification. Work only the less affected leg and keep the other foot resting gently flat. Do not force range of motion through acute pain. 3 sessions of this exercise per day consistently significantly improves calf muscle pump function according to research published in Phlebology, the peer-reviewed journal of venous disease. Tip number 4, hydrate deliberately and reduce dietary sodium. Dehydration causes blood to become more viscous, thicker, which makes it harder for weakened valves to move blood efficiently. The NIH recommends a daily fluid intake of approximately 2.7 liters for women and 3.7 liters for men from all food and drink sources combined. For people managing venous insufficiency, staying well hydrated is not optional. It is vascular maintenance. At the same time, excess sodium causes the body to retain water in the tissues, worsening leg swelling. Reducing processed foods, canned soups, and deli meats can reduce lower leg edema noticeably within 1 to 2 weeks. Tip number 5, break up long periods of sitting or standing every 30 minutes. This is one of the most powerful and most overlooked interventions. When you sit still for extended periods, venous blood pools in the legs passively. There is no muscle pump working. A simple strategy: set a gentle phone alarm for every 30 minutes. When it goes off, stand up and walk for 2 to 3 minutes. Even a short walk to the kitchen and back activates the calf muscle pump enough to partially drain the pooled blood. If you are standing for long periods at a counter, in a kitchen, shift your weight from foot to foot and raise up on your toes briefly every few minutes. These micro movements are proven in vascular research to reduce venous pooling measurably. Tip number 6, know the warning signs that require medical attention now, not later. Most varicose veins are manageable with lifestyle measures, but some symptoms tell you the condition has crossed a threshold. See a doctor promptly if you notice sudden swelling in one leg only, not both, which can indicate deep vein thrombosis. If the skin over a varicose vein becomes red, warm, or hard to the touch, if an open sore or wound on the lower leg is not healing within 2 weeks, or if a varicose vein bleeds, even from a minor bump. These are not situations for home management. A vascular specialist can order an ultrasound, a painless, non-invasive test, to assess the exact state of your veins and guide the safest treatment for you specifically. And now, tip number 7, the one we promised you at the start. This is what happens while you sleep, and most doctors never think to mention it. When you lie flat at night, your legs are finally at heart level, which is good. But if you sleep on your side with one leg pressed down under the other, you are compressing the veins in your lower leg for hours. This restricts venous return from that leg, and you wake up with one leg more swollen, more stiff, and more painful than the other. The solution is simple and costs nothing. Place a firm, standard bed pillow between your knees and another under both calves so that your legs are gently separated and slightly elevated at the same time. This keeps the veins open and draining passively throughout the entire night. Clinical guidance from the Society for Vascular Surgery specifically recommends nighttime leg elevation as a component of conservative venous insufficiency management. 8 hours of passive venous drainage every single night is cumulative. Over weeks, this habit alone can reduce morning stiffness and swelling significantly. I have summarized everything on the screen. Take a screenshot right now or download the free guide from the description below. It is there waiting for you. And here is why keeping this matters. When you wake up at 3 in the morning with your legs aching and you cannot remember what you were supposed to do, this file removes all the guesswork. You do not need to search through videos. You do not need to remember. It is right there. The 7 tips, the exercise with the breathing cues, the sleep position, the warning signs, all on one page. That is the difference between a habit that sticks and advice you heard once and forgot. Consistency is what changes these veins over time, and consistency is easiest when the information is within reach. And since you have taken this step for your veins today, your circulation is the thread that connects everything: your legs, your heart, your energy. Click the video on your screen right now. It is the perfect next step for your body. Subscribe to the lab. Stay strong. Stay safe.